Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, since my hip surgery, I've been feeling a lot better, more mobile, but there's still this persistent issue with my urinary function. It's really frustrating. I've been using a catheter for relief because I can't seem to empty my bladder completely, and the flow is just too weak.
I understand that must be quite bothersome for you. Tell me a bit more about how often you're having to use the catheter.
Pretty much daily, especially in the evenings. It's like I can feel that not everything comes out, and then I have to use the catheter to avoid any discomfort overnight. I've been on Flomax for a while now, and you mentioned starting finasteride.
Yes, that's right. Finasteride can help reduce the size of the prostate over time, which might improve your symptoms. We'll discuss the benefits and any potential side effects later in our session.
I hope it helps. Also, my blood pressure has been a bit high lately. I've been monitoring it at home like we discussed last time. The readings were often around the 160s over 90. After resting it drops, but it still concerns me given my history with hydrochlorothiazide.
Good job on monitoring it. It's important we keep a close eye on that, especially with your previous experiences of low blood pressure. How about your recovery from the hip surgery? How are you managing with your daily activities?
It's going better than expected, actually. I'm walking around the house a lot more, sometimes even without any help. I'm still cautious, of course, but it feels good to be more independent. I do exercises at home that the physiotherapist showed me.
That's great to hear. Being active will definitely help your recovery. Have you noticed any other symptoms or concerns, perhaps related to the medications or otherwise?
Not really, aside from the issues with my prostate and blood pressure. Though, there is this one thing. I've been using a salve for a skin issue on my nose. It's been persistent, so I have an appointment with a dermatologist to check it out.
Good that you have that scheduled. Keeping up with all aspects of your health is crucial. Let's ensure you continue to monitor your urinary symptoms closely and report any changes, especially once you start on finasteride.
I will. I just want to make sure I'm doing everything right to manage these issues. It's a lot, between the prostate, my hip, and keeping track of my blood pressure.
Absolutely, it can be overwhelming, but you're handling it well. Let's go over your recent clinical measurements and lab results to give you a clearer picture of where things stand. Your blood pressure today, after resting, is 140/85 mmHg, which is better than when you first came in. Your weight is stable at 180 pounds, and your height remains at 5 feet 9 inches. giving you a BMI of 26.6, which is in the overweight category, but close to normal.
That's a relief to hear. I've been trying to watch my diet as well.
That's good. Your PSA level is at 0.8 nanomilliliter, which is quite low, suggesting that your prostate condition is currently managed well with medication. Your kidney function, with a creatinine level of 1.2 milligram per deciliter and a BUN of 18 milligram, is stable. Your complete blood count and liver function tests are also within normal limits. The X-ray of your right hip shows good alignment post-surgery with no complications, and your abdominal ultrasound showed a moderately enlarged prostate without significant obstruction.
That's a lot of information, but it's reassuring to know things are mostly stable.
Indeed, it is. Here's the plan moving forward. We'll start you on finasteride and monitor its effects on your prostate symptoms. We'll continue monitoring your blood pressure closely, especially to prevent episodes of hypotension. Keep up with your physical activities and follow up with your specialists as scheduled. I would like to see some blood tests done before our next appointment to ensure there are no adverse effects from the new medication.
Understood. I'll get those tests done and keep a close eye on everything until we meet again.
Perfect. I'll schedule a follow-up in 3 months, but please contact us if there are any concerns before then. It's important we manage these issues proactively.
Will do, Doctor. Thank you for clarifying everything today. It helps a lot.
You're welcome. Take care and see you next time.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, doctor. I've come in today because I'm really concerned about my blood sugar levels. They've been higher than usual despite taking my medications. My last HbA1c was 9%, and it's really worrying because I was maintaining around 7.2% previously.
Good morning. I appreciate you coming in to discuss your concerns. It's important that we look into the reasons why your blood sugar levels have increased. Can you tell me more about any changes in your diet or exercise routine lately?
Well, I used to be quite active, but over the past few years, I've slowed down a lot. I had plans to start exercising more, but I just haven't gotten around to it. My eating habits haven't changed much, though. I've always tried to keep a balanced diet since my diabetes diagnosis.
I see. It's also important that we consider your medication changes. You switched from glyburide to glipizide recently. How has that transition been?
The switch was fine. I didn't notice any adverse effects, but I'm not sure it's working as well as the glyburide. I stopped taking Actos too because I was worried about the potential risk of bladder cancer.
Understood. It's good that you're mindful of the medication side effects. Have there been any other changes in your health recently? Any new symptoms?
Not really new symptoms, but I've had some ongoing issues. I'm still having trouble with my vision. I know I need to get my eyes checked soon because I'm worried about retinopathy. And my feet, there's this constant numbness due to the neuropathy. It makes getting back into exercise a bit daunting.
Yes, it's crucial to manage those complications carefully. How about your thyroid medication? I noticed your TSH levels are a bit low.
I've been taking the medication as prescribed, but I did read about potential liver effects, which worries me a bit since my liver enzymes have been elevated.
That's a valid concern, especially with your liver enzyme levels being up. We'll need to monitor that closely. Now, regarding your erectile dysfunction, you mentioned some issues with getting refills for Viagra?
Yes, it's been a hassle sometimes. It would be easier if I could get a refillable prescription so I don't have to go through this every few months.
We can definitely arrange that for you. Having easier access to your medications is important. Now, let's discuss the plans for your liver health. You mentioned you're waiting for a liver ultrasound?
That's right. I'm scheduled for an ultrasound next week. I'm hoping it doesn't show anything serious. With everything else going on, I'm just trying to manage one day at a time.
Absolutely. Taking things step by step is the way to go. Let's also ensure you get your eye exam and diabetic foot exam scheduled soon. It's important to keep on top of these things to prevent any further complications.
I will. I've been trying to manage everything the best I can, especially since I'm living alone now. It's a bit tougher without someone to help keep track of everything.
I understand, and we're here to support you. Based on what we've discussed today, let's summarize and plan our next steps. First, your elevated HbA1c indicates that your diabetes isn't as well controlled as it could be. We'll increase your glipizide dosage to 7.5 milligrams twice a day and continue monitoring your blood sugar levels closely. If necessary, we can adjust your metformin as well. Your concerns about your liver are noted, especially with the elevated liver enzymes. The upcoming liver ultrasound will give us more information. Depending on the results, we may need to adjust your thyroid medication or explore other causes for the enzyme elevation. For your vision and foot health, I will make sure our team schedules you for an eye exam and continues regular diabetic foot exams. It's crucial to prevent serious complications like retinopathy and further neuropathy issues. Lastly, I'll arrange for a refillable prescription for your Viagra to ease the process of managing your erectile dysfunction. We will follow up with you after your liver ultrasound, and I want you to come back in a month to review everything. How does that sound?
That sounds good, Doctor. Thank you for taking the time to go through everything with me today. I feel a bit more at ease knowing we have a plan moving forward.
You're welcome. It's important that you feel supported and informed about your health. If you have any questions before our next meeting, please don't hesitate to call the office.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
I understand that you've been experiencing some gastrointestinal issues lately. Can you describe your symptoms a bit more in detail?
Yes, since I started my new treatment, I've been feeling nauseous almost all the time, and I can barely eat anything. It's really affecting my energy levels.
That's quite common with your type of treatment, unfortunately. But it's crucial that we manage these side effects so you can keep up your strength. Have you tried any specific dietary changes or medications for the nausea?
I've tried eating smaller meals more frequently, but it hasn't really helped. I haven't taken any medication for nausea yet.
All right, I recommend we start with an antiemetic to help control the nausea. Ginger tea can also be soothing and might help with your appetite. I want to make sure these symptoms are managed so they don't interfere with your treatment. Let's schedule a follow-up in 2 weeks to see if these adjustments improve your symptoms. It's also important that you try to stay hydrated and rest as much as you can in the meantime.
Now look at question 26.
I've reviewed your recent lab results and noticed there's been a change in your heart function, which can affect how your body handles medications. We need to adjust your dosages to ensure they remain effective yet safe.
So, will I be taking more of the medication or less?
You'll actually be taking less. The dose you're currently on is higher than what your body can now process safely. I will coordinate with your doctor to lower the dosage, and we will monitor how you respond to the adjustment.
How will these changes impact my day-to-day life? Will I notice a difference?
You might actually feel better overall, as the correct dosage should help minimize potential side effects. However, it's also possible that you won't notice any immediate changes. The key is to prevent complications. We'll keep a close eye on your progress and adjust further if needed. It's very important that you contact us if you experience any new symptoms or if there's anything that feels off.
Now look at question 27.
I wanted to discuss the assessment results with you regarding your mother. We have diagnosed her with early-stage dementia. I know this news can be hard to hear.
Yes, it is difficult. What steps should we take now? How do we handle this moving forward?
First, it's important to focus on support and maintaining a high quality of life. We'll need to adapt her living environment to ensure it's safe and supportive. Establishing a consistent daily routine will help manage her symptoms and reduce confusion.
Is there any particular treatment or activities that would help her at this stage?
Engaging in mentally stimulating activities and maintaining regular social interactions can be beneficial. We also recommend that your family consider joining support groups, which can be incredibly helpful for both your mother and your family as you navigate this journey together. Our team is here to support you with resources and guidance every step of the way.
Now look at question 28.
I strongly believe that being realistic is crucial. We need to prepare patients with terminal illnesses for the reality of their condition, focusing not just on emotional, but practical aspects as well.
I understand where you're coming from, but my perspective emphasizes maintaining hope and a positive mindset. This approach can significantly enhance the quality of life for these patients.
But isn't fostering hope sometimes misleading? Shouldn't patients be fully aware of their prognosis?
It's about finding a balance. Yes, they should understand their situation, but we also need to encourage them to make the most of their time left, in whatever form that takes. It's not about false hope, but about enriching the life they have remaining.
That's a fair point. Providing a balance of coping mechanisms and activities that bring joy could indeed make a significant difference. It's not just about extending their days, but enriching them, making every moment count.
Now look at question 29.
Let's focus on crafting a thorough discharge plan for our young patient. Considering the lack of a strong support system at home, we need to be extremely meticulous in our planning.
I agree. I've already been in touch with several foster care services that have experience in handling medical cases. They are prepared to take him in once he's discharged and will provide the necessary medical care.
I'll make sure all his medication and physical therapy needs are clearly communicated to them. It's critical that there's no disruption in his care.
And I'll set up ongoing counseling sessions for him. Adjusting to a new living situation can be tough, and it's important we support his emotional and psychological health during this transition.
Excellent work, everyone. Let's ensure all these plans are firmly in place before we finalize his discharge date. It's essential we work as a team to ensure his transition is as smooth as possible.
Now look at question 30.
Now that we've established your diagnosis of COPD, it's crucial we start on a management plan right away to help you breathe more easily.
What exactly will the management entail? Are there many changes I need to make?
We'll begin with some medications to help open up your airways, and I will teach you some specific breathing techniques that you can use during flare-ups to make breathing easier. Also, quitting smoking is absolutely essential for your lung health.
I've been thinking about quitting smoking for years, but it seems I finally have a strong reason to commit.
It's definitely challenging, but the benefits of quitting are immense, especially for your condition. We can also explore other lifestyle changes, such as improving your diet and incorporating gentle exercise, which can help improve your lung function. I'll be here to guide you through every step and make adjustments as needed to your treatment plan based on how you're responding.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Welcome everyone to today's session on recent advancements in the management of ANK-associated vasculitis, AAV. I'm Dr. Smith, a rheumatologist with a keen interest in autoimmune diseases. Today we will delve into the complexities of diagnosing and treating AAV, drawing on the latest guidelines and a case study that highlights the practical challenges and emerging therapies in this field. Firstly, let's discuss the nature of ANK-associated vasculitis. AAV is a group of diseases characterized by inflammation and damage to blood vessels, primarily affecting small vessels. This includes granulomatosis with polyangiitis, GPA, microscopic polyangiitis, MPA, and eosinophilic granulomatosis with polyangiitis, EGPA. These conditions are potentially life-threatening due to the risk of organ failure and require prompt and effective treatment. The pathogenesis of AAV involves autoantibodies known as ANCA, or anti-neutrophil cytoplasmic antibodies, which attack neutrophils, causing them to degranulate and damage the endothelial cells of blood vessels. This autoimmune attack leads to widespread vascular inflammation and necrosis. Now let's turn our attention to the diagnosis and management of AAV, which has seen significant updates in recent guidelines. Diagnosis primarily involves clinical evaluation, serological tests for ANCA, and tissue biopsy if necessary. Once diagnosed, the mainstay of treatment has traditionally been immunosuppression. Historically, cyclophosphamide, a potent immunosuppressive agent, has been used extensively in the induction of remission. However, due to its severe side effects including infertility, malignancy risk, and infections, its use is being reconsidered. Recent trials have shown that rituximab, an anti-CD20 monoclonal antibody, is as effective as cyclophosphamide in inducing remission, but with a better safety profile. This has shifted the treatment paradigm towards using rituximab, especially in patients with relapsing disease. Let's consider a case that illustrates these points. We recently treated a 48-year-old male patient, diagnosed with GPA, who presented with renal impairment and pulmonary hemorrhage, a scenario indicating severe disease. Initially, he was treated with cyclophosphamide and high-dose steroids. However, he developed leukopenia and significant bone marrow suppression, complications associated with cyclophosphamide. Given his adverse reactions and the need for ongoing immunosuppression, we transitioned him to rituximab. His response was remarkable, with stabilization of renal function and resolution of pulmonary symptoms. This case highlights the importance of individualized treatment plans and the benefits of newer therapeutic agents like rituximab. Furthermore, recent guidelines suggest a reduced reliance on steroids, given their side effects, including infection and metabolic issues. A study known as the PEXAVUS trial investigated the use of plasma exchange in AAV and found no significant benefit in terms of survival or end-stage kidney disease, which is altering how we think about managing severe cases. Another emerging treatment is avacopan, an oral complement 5A receptor inhibitor, which has shown efficacy in replacing steroids in some patients, reducing exposure to steroids, harmful effects while effectively controlling disease activity. In terms of maintenance therapy, after remission is achieved, the guidelines recommend less toxic drugs like azathioprine or methotrexate to keep the disease in check without the harsh side effects of cyclophosphamide or prolonged steroid use. Patient involvement in guideline development has been a novel approach in recent years, reflecting a shift towards patient-centered care. This inclusion ensures that treatment guidelines address patient concerns about medication side effects and quality of life, which are crucial for adherence to treatment regimens. The management of ANCA-associated vasculitis is evolving, with a shift towards using biological therapies and less toxic treatment regimens. This approach not only improves patient outcomes, but also addresses the quality of life concerns that are often sidelined in traditional treatment models. As we continue to see advancements in the field, it is vital to stay informed and adapt to new evidence, ensuring our patients receive the best care based on the latest scientific understanding. Thank you for joining today's session. I hope this discussion has been enlightening and will aid in your practice. We must continue to advocate for and utilize research-driven approaches to improve the lives of those affected by these challenging diseases.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Today we'll delve deep into the topic of tuberculosis TB elimination and the pivotal role of quality care in this public health endeavor. Our focus will be on the complexities of TB management and the integral components that must converge to combat this enduring health threat effectively. Let's begin with a recent case that exemplifies these challenges and the critical nature of our discussion. A 34-year-old male, Mr. A, residing in a high TB burden country, was diagnosed with multidrug-resistant tuberculosis, MDR-TB, after several months of experiencing nonspecific symptoms such as a persistent cough, weight loss, and fatigue. Initially treated for presumed bacterial pneumonia, repeated antibiotic courses did not alleviate his symptoms, leading to further investigation and eventual diagnosis of MDR-TB. This delay in accurate diagnosis and appropriate treatment commencement highlights significant gaps in the healthcare system's ability to manage TB effectively. The first major challenge in TB elimination we encounter is the diagnostic conundrum. Despite advancements in diagnostic technologies, access to precise and rapid testing is not uniformly available globally. For instance, molecular diagnostic tools such as the GeneXpert MTB-RIF, which can detect TB and its resistance to rifampicin within hours, are still not accessible in all settings, particularly where TB is most prevalent. The case of Mr. A underscores the need for widespread availability of these technologies to ensure early and accurate diagnosis. Another layer to this challenge is the treatment of TB. The standard treatment for TB has been a course of multiple antibiotics taken for at least 6 months. However, for MDR-TB, like that of Mr. A's, the treatment is more prolonged and complicated, involving more toxic and expensive drugs, which are often out of reach for many in low-income settings. The complexity of the treatment regimen for tuberculosis, coupled with its potential side effects, often results in poor adherence among patients. This issue is further exacerbated by the socioeconomic challenges that many individuals with tuberculosis encounter, including limited access to health care, financial constraints, and a lack of social support, all of which can hinder effective management and control of the disease. Now let's talk about the concept of quality of care in the TB treatment cascade. Quality of care is multidimensional, encompassing patient-centered approaches that consider the patient's cultural, social, and economic context. In Mr. A's scenario, the integration of patient support systems, including counseling and nutritional support, alongside his medical treatment, were crucial in his adherence to the treatment regimen. This holistic approach not only addresses the medical needs, but also the psychological and social barriers that affect treatment outcomes. Furthermore, the public health approach to TB control involves contact tracing and preventive treatment for those at high risk, such as family members of patients with TB. However, these strategies are often limited by resource constraints and the lack of trained healthcare workers, especially in high-burden countries. Innovations in digital health can play a transformative role here, offering tools for better data management, patient follow-up, and even remote monitoring of treatment adherence. As we explore the societal impacts, we recognize that TB is not just a medical issue, but a complex socio-economic challenge that requires comprehensive strategies encompassing health education, community engagement, and political commitment. The elimination of TB demands a concerted effort not only from healthcare providers, but also from all sectors of government and society to address the root causes and implement effective, sustainable health interventions. The case of Mr. A is a stark reminder of the myriad challenges faced in the fight against TB. It underscores the need for an integrated approach that combines advanced diagnostics, accessible and patient-centered treatment regimens, and robust public health strategies. By focusing on these areas, we can move closer to achieving the goal of TB elimination globally, ensuring that no one is left behind in our pursuit of health equity and disease eradication.